I'm here to do my head-to-toe exam on baby girl Smith, who was born via C-section 12 hours ago at 32 weeks. Delivery was indicated due to worsening maternal preeclampsia. Mom did get mag sulfate, and initially baby girl Smith had some CPAP when she came back to the NICU, but has since weaned to room air and appears to be breathing comfortably, but has had, occasional intermittent apnea, possibly secondary to prematurity, or could also be secondary to maternal mag sulfate administration. So what I want to do is just go over everything that we have set up for the exam. Baby girl Smith is on a radiant warmer bed so that we avoid cold stress. During our exam, we have all our supplies here. So I have a stethoscope, I have a measuring tape, an ophthalmoscope, and of course a pacifier in case she gets agitated during the exam. We want to be able to comfort her. All right, so before I start the exam, I want to introduce myself to the parents who are in the room with me today. Mr. and Mrs. Smith, congratulations. My name is Naomi and I'm a neonatal nurse practitioner. I'm here just to do an exam on your baby and answer any questions you might have. Did you pick a name for her yet? Amelia? Gorgeous, I love it. All right, so I'm here to just look at Amelia, and at the end, whatever questions you have, feel free to ask me. Wanted to do this exam before we round with the doctor. So what rounding is every day we meet as a team to talk about your baby and to adjust whatever plan of care we need to support her as she grows and develops. Rounds are typically between, they're typically in the morning. Typically you'll see the doctor, your baby's nurse, myself or another neonatal nurse practitioner, possibly a respiratory therapist. Will include nutrition, and we also encourage you to be there for rounds as well. We really want you to understand that you are such an important part of her team, and we want you to understand everything that's going on with her. I know a lot of this stuff is new, but we also want to make sure that you understand everything and have the opportunity to ask us any questions that you have, okay? If I could answer anything for you right now, let me know. Otherwise, we'll get started on her exam. Okay. All right, so I'm going to start with hand hygiene. I'm going to start by observing Amelia in her resting state. I want to get as much information as possible before we start touching her. She could start to get agitated, and this really gives us a picture of so many important things before that happens. So I'm looking at her general appearance. Her position at rest seems comfortable. She does not appear to be in a hypertonic state. She's not abnormally flexed or abnormally extended. She looks comfortable. She does not look like she is retracting or having any abnormal work of breathing. I don't hear any grunting. Her nares aren't flaring. So from a respiratory standpoint, she looks comfortable. I'm looking at her skin. Her skin is pink. She looks well perfused. She does not look jaundiced. I don't see any rashes or lesions. If I'm looking at her face, her eyes are spaced appropriately apart. I don't see any clefts. Her ears appear in normal position. Don't see any hematomas or masses on her head. Looking at the face can sometimes give us a really good picture of any possible dysmorphisms. I'm looking at her extremities. I don't see any afrocyanosis, which could be a normal finding at this age, 12 hours old, but I don't see it. I don't see any polydactyly or syndactyly. She looks like she has 5 fingers and 5 toes on each side. Her nail beds are not meconium stained. Her nails look normal, present on all of her fingers and toes. She's not abnormally contracted. Looking at her abdomen, she's not distended, it's flat, there's no loopiness, it looks pink. Her umbilical cord does not look like it has any signs of umbilitis. There's no bowel protruding through, which could be a sign of an omphalocele. I see 3 vessels. The cord is clamped. The jelly is starting to dry, but it looks like a normal thickness. I'm looking at her neck. It's not webbed. Everything looks, nothing standing out to me. Okay, next I'm going to proceed with auscultation. I'm going to start with her lung sounds. But before I do that, I'm going to warm the stethoscope a little bit. I want to listen to her lung sounds for a full minute so that I can get a full respiratory rate. I also want to note the presence of any abnormal breath sounds, stridor, wheezing, rhonchi. I want to make sure they're not diminished, that they're clear and equal on both sides. I'm going to listen to them in all areas. And they really should be, equal on both sides. Her axilla towards the back. It's okay, sweetheart. Just listening to you. Okay, she sounds clear and equal bilaterally. I'm gonna listen for a full minute. So her respiratory rate is 50 breaths a minute. Mom and Dad, that's exactly where we want her to be. Normal range for a baby of her age and her size is between 40 and 60 breaths a minute. So 50 is definitely great. All right, so I'm going to listen to her heart next. I want to note the presence of any murmurs or thrills. I want to hear S1 and S2. And I'm going to listen for a full minute for a heart rate. Okay, her heart rate is 145 beats per minute. Mom and Dad, she sounds like she has a strong heart. And 145 beats a minute sounds high because for adults that's definitely high, but for a kid her age and her size, that's just where we want her to be. All right, so lastly, let's just take a listen to your belly. You want to listen in all 4 quadrants for active bowel sounds. Mom and Dad, she still hasn't eaten yet, but we still want to make sure that she has active bowel sounds, so that when we do start to feed her, you know, it gives us a little bit of reassurance that, you know, things are moving. Okay. Belly sounds good too. All right, so next we're going to do a little bit of a more thorough assessment of her skin. But before we do that, I do want to take her measurements. Before I came in the room, I placed her weight on the Fenton growth chart, but I just want to make sure that I have the length and head circumference as well, so that we, you know, have an accurate assessment of where she fits on the growth curves. Okay, she's 50 centimeters long, so nice and tall. All right, let's see what your head is. So for our head circumference, Mom and Dad, the head circumference and the length really give us a good idea, in combination with the weight, where she places in terms of her size. It gives us a good idea of where to start. All right, so 40 centimeters for her head. Want to look at her chest. I'm going to measure her chest across the nipple line. We're at 43 centimeters for her chest, and then her abdomen. And Mom and Dad, these measurements give us a baseline. We'll, you know, continue to do her measurements as she stays with us. We want to make sure that she's growing adequately, and this gives us a good indication of that. 42.5 for our abdomen. Okay. All right. So let's take a closer look at her skin from head to toe, and take a look at everything else as well. So starting with her head, I feel for her anterior posterior fontanelle. It's open, flat, soft. Same thing with her posterior fontanelle. The sutures are not overriding, they're approximated. I don't see any hematomas or masses. I don't feel any abnormalities. I'm looking at her ears. Her pinna is appropriately recoiling. Also looking at her ears, I want to look at any the presence of any skin tags or sinuses, which I do not see any. I see ear canals patent, looks like on both sides. I'm looking at the shape and size of her mandible and maxilla. I don't see any drooping to one side. Gonna look at her nose, which looks like it's midline. Her nares are patent. Gonna look at her eyes next. So her eyelids, I don't see any stork bites or newborn rashes. I don't see any hemangiomas on her face or any abnormal discoloration. I'm going to open her eyes. I want to look to see that her sclera are white and clear. There are no cataracts, that the conjunctiva is clear, not reddened. There's no discharge. I'm going to hold up thaumascope 18 inches from her face and try to elicit the red reflex. Also looking at her pupil size and whether or not they respond to light. The pupils look equal and round and react to light, so that's good. Okay, I want to look inside her mouth. Earlier I mentioned that I did not see any clefts on her mouth, but I want to also look at her hard and soft palate. So I'm going to put my finger in her mouth, and that's going to tell me two things. I'm going to be able to feel if there are masses or clefts on her palate, but I also want to see how strong her sucking reflex is, and she is sucking on my finger. I think she's ready to eat. Okay, so moving down, I want to look at her neck. I don't see any masses. I don't see any webbing of her neck. Her trachea appears midline. I want to feel her clavicles. They feel straight and smooth, no crepitus. While I'm moving down her arms, I want to feel her pulses, but this is also a good time to feel for her femoral pulses before we start to, really agitate her. Could make it harder to feel those pulses. So what I want to do is feel her brachial pulse and her femoral pulse at the same time. This gives me an indication of, if there's a possible coarctation. They feel unequal, but they feel equal on both sides to me. So +2 pulses. I note symmetrical arm movement. She doesn't look like she's wincing in pain. We would be concerned if there was like a shoulder dystocia of unequal arm movement, but it doesn't look like there is. I don't see any acrocyanosis in her hands, although that could be a normal finding in a baby 12 hours old. I want to put my finger in her palm and let her squeeze my finger. She has a strong grasping reflex. I note a peripheral IV in her left arm that's infusing D10 at 80 mLs per kg per day. I'm going to move on to the rest of her chest assessment. Her nipples are appropriately spaced apart. She's not retracting or showing any other signs of work of breathing. Her chest rise is symmetrical. There are no paradoxical chest movements. I don't feel any masses in her axilla or on her chest. The breast tissue seems adequate. I don't see any seesaw respirations. I don't see any barrel chest or pectus. And chest looks good. Okay. While I'm on her chest, I want to feel for the point of maximal intensity. I don't see any hyperactive precordium, although this could potentially be normal as a transient finding if her ductus was still large and hasn't closed yet. Okay. Her 4 extremity blood pressures when we admitted her were reassuring. The difference in the maps between the upper and lower extremities did not raise suspicion. They were about 6 points apart. That maps that are greater than 10 apart could indicate the presence of a coarct if the upper extremities were higher significantly than the lower extremities. I want to feel for her radial and ulnar pulses. Okay. Moving down, I want to take a closer look at her abdomen. I want to feel gently, not going too deep at first. She's not guarding. She doesn't show any signs of withdrawing or tenderness. There's no rebound tenderness. It's soft, pink. I don't see any loops. I want to feel for her kidneys, so I'm going to put my hands under her back like so. And when I'm feeling for her kidneys, I really just want to note the size, the symmetry, and the shape. They should feel equal on both sides. They do. I want to palpate her liver edge. Could feel it about 2 cms underneath the costal margin. Okay, so going back to the umbilical cord, I don't see the presence of any bowel herniating through. It's pink, but not reddened around it. The cord is clamped. There are 3 vessels. No signs of omphalitis. The Wharton's jelly is starting to dry, but looked adequate in size. She is a female, so I note the labia minora, labia labia majora, the clitoris. The clitoral hood is of adequate size without clitoral megaly. I don't see any abnormal openings or skin tags, but I do note the urethral meatus. I will turn her over a little bit just to look at her back. So what I want to look at is from head to toe on her back. Again, no abnormal discoloration of the head. I don't see any masses or lesions. On her neck either. Her spine is straight and intact. Her vertebral column is closed without the presence of a dimple or a tuft of hair. Her gluteal fold is symmetrical. Her anus appears patent with a rectal wink. Turn her back on. Let's put you on your back again. Okay. I want to look at the presence of subcutaneous fat in her thighs, another sign of adequate hydration. I'm looking closer at her hands and feet. I want to do range of motion again. She has equal range of motion in both legs. And I do note some spontaneous movements as she's like waking up a little bit more in all of her extremities. I don't see any contractures. Again, I'm looking at the bottom of her feet. I see some ridges, consistent with her gestational age. No syndactyly, no polydactyly. Her toes are not meconium stained. Her nail beds are not meconium stained. And she has nails on all of her fingers and toes. Okay. I am going to do a hip exam. Mom and Dad, the hip exam tells us, a little bit about the strength of her hip and also if there's, any sign of dislocation. So what we're going to do is just gently push them back like this. I don't feel any clicking into place. I want my finger right here. And that feels normal. No dislocation. Okay. All right, so when we began the exam, she was like in a quiet state. As we proceeded through the exam, she's woken up a little bit more, but she still appears calm, hasn't cried. We haven't had to really console her too much. I want to also look at how she's following my voice. So she definitely opens up her eyes when I'm talking. When Mom asks questions, she definitely recognizes her mom's voice and is responsive to that. When I look at the rest of her reflexes, I already checked her sucking reflex when she sucked on my finger. Good sucking reflex. I want to elicit the rooting reflex, which she has. I want to assess her Babinski reflex, which just means that I'm going to put my finger starting from the heel up the middle of her foot and watch as her toes kind of flex out like that. I want to assess her Moro reflex, also known as the startle reflex. I'm going to assess her head and neck tone using something called the head lag maneuver. So I want to put my hands under her shoulders and look at the presence of a head lag. Gently, of course, because the muscles in their neck are still not strong enough to support their head on their own. Then I want to do a test of her trunk tone in ventral suspension. I'm going to gently flip her over like this and assess her tone in this position. Okay. From here, we can look at her stepping reflex. Again, we're going to support her head and assess her stepping reflex. Put her back down. The last reflex we want to look out for is something called a fencing reflex. So what that basically means is I'm going to turn her head to the side, and on the side that I turn her head to, her extremities will extend. All right, Mom and Dad, do you have any questions about what we just did? We kind of looked at everything. I'm going to talk to the doctor. Everything looks really good. And we will start round shortly. All right, so at the end, I'm going to make sure that all her lines are in place, that she's comfortable in a developmentally appropriate position to go back to sleep. Gonna put this head back up to keep her safe. And mom and dad, I'm going to talk to the doctor. We're gonna start round soon. I'll give you a full picture of what our plan will be for the day, and then whatever questions you have, we want to hear them. Okay, congratulations.